First of all, thank you very much for this opportunity. What a difference 1 week makes. I was one of the speakers at the inaugural webinar last week, and here we are in a total mess in a country that was already doing badly, but now God knows with this new minister. I would like to start these remarks reminding you on the definition that Bob Butler, the founder of the International Longevity Center, which I now represent, when he coined the word ageism. And he said then that we are either black or white, woman or man, but we all aspire to get older. Unless, I would add, somebody decides to kill us because we dare to become old. I would also like to quote Albert Camus, who said in The Plague that the only way to fight a plague is by being decency. And that is the situation that we are now. We are in a very polarized country with an ultra-right, I dare to put the name, really fascist government that has no respect for human life, that has impoverished the population, that has broken the health system, and now is looking with some degree of perplexity what they have done. I should add to the three wonderful speakers that we cannot look at ageism in isolation. We have to consider the overlapping with sexism, racism, remind ourselves that the most frequent victims of what is happening are black and brown and immigrants and minorities. We also have a context of poor phobia. We don't like poor people. They are dirty. They live in appalling conditions throughout the developing world. I'm speaking from Brazil, a country with unacceptable levels of social inequality. And so often they are blamed for the conditions they live with. Wash your hands, but we don't have water. Wash your hands, but we cannot buy soap. It is basic as this. And now we have a new minister who has good credentials of being very articulate, very intelligent, but he's a businessman. He doesn't have any training as a public health doctor. To the benefit of doubt, the statement that Peter showed at the beginning was not in his inaugural speech as minister yesterday. And the defenders say that it was taken out of context, but that is what he said, that we have to choose. We have to choose if there is someone that is old and someone that is young. So we don't have a protocol. It is going to be left for health professionals to make the decision. But the reality is that Brazil is in the front line. Pay attention to what is happening in this country, because it's going to be repeated throughout the South within this context of broken health systems, because for the last 4 years, what was not already working and functioning well has been sacked. The resources have been taken away, the universal health system under threat, because people like the new minister representing big business in the health sector are against having a universal health system. Jane quite wisely said that 3 key words are test, isolate, and trace. How can we test if what we buy from China, from South Korea to test is taken away when the planes stop over in Florida and they look at the content, say, you are taking this to Brazil? No, it's going to stay here. Confiscated conspiracy. How can we isolate, as she has put so well, if people living on top of each other in favelas without sanitation, without sewage, without water? How can we trace if our president himself probably infected because he went in March with a delegation from Brazil to kiss the hands of Mr. Trump, and 22 of the delegation came infected. He has refused so far to show that he had 2 negative tests. And he goes around in the ultra populist way, kissing his crowd, his fanatic supporters and followers, embracing them, taking shelves, going to bars to have breakfast with the crowd, the population. So that is the context in which we are. And I should just, to finish these remarks, remind, and I don't need to remind Jane because she was our partner at the time. I was the director of the WHO program on aging and health. And we commissioned 16 case studies looking at emergency situations throughout the world, from floods to tsunamis, earthquakes, and you name it. And in all of them, older people, yes, were seen to be vulnerable. But above all, they were seen as resources to their communities. They would bring the communities together. They could hold the communities together. They could see the end of the line, a light at the end of the tunnel, because they had gone through situations that would make them critical for their communities. And now we are thrown into the dustbin because we are old. I should say in a very personal note that I love my mother as much as I have always done, and she is 102. And more than ever, she needs care and protection. It's the protection of human life, whatever the age of this life is. As I hope and know that my children love me as much as they used to love me, now that I am 74. I think that we have the makings here through this webinar to launch a global action that will respect decency, that will respect ethical values and moral. After this pandemic, we cannot go back to the normal because the normal was part of the problem. I remind you that the mantra from the Silicon Valley was move fast and break things. After that, we will have to move more calmly and fix the things around us. There has never been a worse place and time to get older than Brazil at the moment.